أسعد الله مساءكم جميعا.
Good evening and welcome once again to a very important session in this very important conference. We realize that it's very difficult to go back quickly after lunchtime. Due to this, we shall start talking.
To deliver this in English, but I guess because we all speakers and moderator here presenting some major Arab institutions, so we chose to speak in Arabic and we rely on translators and we thank him in advance. ودعوني قبل أن أشرع بتقديم المتحدثين
Before I start talking and introducing, to express all my thanks and gratitude for Dr. Al-Katbi. In reality, we say that this conference every year is the best of its kind, but surprises never stop. We need to say that, and definitely this gathering is considered the most privileged in all the meetings that happened in the region and through ADSD. And to you and to the speakers and to the attendees, all thanks and gratitude. Regarding our subject, so many people are wondering what it has to do with the strategic debate and why this nexus between climate and health and public health. It is one of the subjects of the strategic debate given by the center. But as you all know, that 5 years ago or a decade ago, we used to say that it is emerging challenges. But a while ago, it has become a reality. And it's not emerging anymore, but rather a true challenge for the countries and the nations and the governments. Regardless of the discussions that are really skeptical of our subject today, and is the climate change politicized? The issues of environment, are they politicized? And is it the making of mankind, whether on purpose or not? And there is something more important, which is education. We have three sides for this subject. I'm pretty sure that our speakers will talk about it completely. And with your participation, we shall lead to a deep understanding of this phenomena. The first kind is the scientific side of the weather changes and its linkage to the public health. Second, regarding the public policy, is related to dealing with those two issues because they're linked and interlinked. And third, we're talking here about the security and strategic challenges that are linked with these challenges, weather, environment, and its impact on public health. We all know that the concept of global health security has become an integral part of the comprehensive concepts of the national security. Allow me to introduce the speakers, the three speakers. The first speaker, Dr. Hawaa Al-Mansoori, member of the Federal National Council in UAE, consultant endocrinologist. Her Excellency Dr. Hawaa Al-Mansoori, and she's a consultant endocrinologist, and she works as a CEO at the stem cells in a center in Abu Dhabi and Imperial College London for diabetes in Abu Dhabi as well. We're talking here about empowerment of women, a number of awards that she got, and so on and so forth. Welcome. We shall start talking with you after I welcome both our guests. Dr. Nadim Farajalla, we are very happy having you around. He's a specialist in climate change environment program, and he's a doctor. He has a master's degree from Utah and a baccalaureate from the AUB. He has worked in the private sector and other academic sector, and he has established so many different initiatives, and today he is an integral part of the Issam Institute for Public Policy and International Affairs as director, Climate Change and Environment Program. Our next guest from Egypt, Dr. Magdy Allam, Manager of Climate Change Program as part of the sustainability of the agricultural plantings, where he is the manager in Jeff Sale in Egypt and a member in the international network to limit the threats of catastrophes, and its headquarters in London, and a member in Germany and other as well important positions. We shall start with you, Dr. Hawaa. Let's talk about change in climate change and public health. How can you simplify this issue to get it in our heads in a very important manner? Go ahead, madam. Allow me in the beginning to express my thanks and gratitude for inviting me to this privileged conference and giving me the opportunity to talk to you about this very important subject. In a simplified manner, as you've said, what is health? What is public health? What does it mean? How do we define it? Why this importance? I think how I look at things is that it impacts us all, and it is about an interaction between all creatures on this planet. Since health deals with everything, whether with pandemics, and we have the experience of COVID, whether through the sicknesses that perhaps come from animal species, or in the economic sector, because it has an impact on the economy of the countries, whether as well on our daily lives. As you all know, member in the National Council. In the beginning, I would like to say a very small story. There was the elections, and I got nominated, but I did not win. It was a great experience, and afterwards I was appointed. But throughout the experience of the elections, I was asked a question, and it was very important. Why are you talking about health? What about other subjects? So to answer these speculations, health is everything. The productivity of the person in work, whether directly or indirectly, the sustainability of the environment, sustainability of the economy of the countries. How can a father provide a suitable environment and the income if he wasn't healthy? And how the students study if they're not really healthy, and so on and so forth. And therefore, for this reason, the health sector has an impact, psychological and emotional. It's very important, whether this on a personal basis or worldwide basis. Very happy. Thank you very much. And I'm happy for this intervention. I shall come back to you after the intervention of the colleagues in details to what we need to do in the field of public health. Dr. Nadim. In reality, talking about public health and its importance, the question here is the following. Where is this interaction between the climate change and public health? How can we define that scientifically? Is it real or is it exaggerated? And then you can explain the reasons behind these changes. Thank you, and thank you for receiving me in this really special forum. It's amazing indeed. Your question is right to the point. We have a problem. So many different skeptical comments which are linked with our normal lives. This climate change definitely is a result of mankind. The fossil fuels is very important in the climate change, but it's being linked to the spread sicknesses is not clear. I would like to shed light on a number of incidents. There's climate change in a number of regions on the planet will reflect an increasing temperature. And this is very good for the scourges that hold sicknesses. Therefore, the season of its growth will increase because the temperature will be expanded on a longer term. So these sicknesses that can be moved from into animals, for instance, which we use in agriculture or in nature. So getting exposed to sicknesses will increase, as well as when temperature changes, there are certain ecological systems that will move to certain places. It wasn't there before, and with it, the insects and the scourges that will take with it the sicknesses, and the insects itself do not have antibiotics present, and therefore so many different sicknesses such as dengue fever in a number of places in Africa, Lyme disease, it is spreading as well in a number of places in America because the temperature is increasing. Ebola in Africa, it is increasing because the bats are taking it and moving it from one place to another. It has space now, and the hantavirus, it is increasing and moving. So in addition to sometimes climate change is increasing the water scarcity, and we have seen the symptoms of cholera increasing in Syria and spreading in Syria. And the reason behind its spread, not because cholera has been the result of climate change. No, it has narrowed down the water, along with other circumstances that we will be talking about later, and the agriculture was obliged to use other water for agriculture or for irrigation, and this has come into food and now cholera. Now the spread has come to Lebanon and Turkey and now to Iraq. So this spread is very dangerous, and this is part of the examples. Thank you very much, Doctor. Because definitely these sicknesses that have a direct causal effect, the environmental and climate change. Dr. Magdy, we have seen this. We shall go back to Dr. Hawaa to see that the World Health Organization sees that the climate change is a health challenge in the world, and this needs also a lot of interest. We shall start with Dr. Magdy. What is at stake? In the name of God Almighty, in reality, we want to simplify sciences, which is very important, and therefore the agreement that we are celebrating in Egypt this year is the UNFCCC. So we can say it COP, but it is a triple C. Why? Because it is United Nations of Parties for Climate Change Convention, 3 Cs, but we put it as an abbreviation and put it as COP27 for the 27th time. where the General Assembly for the Climate Change Convention is being convened. 3 conventions responsible for environment. We're talking here about fighting the desertification, and this in Algeria, and the second agreement, which is the Biodiversity Convention, and it was in Berlin, in Germany, and the third agreement, which is the climate. And this agreement has been agreed that it is being convened every year in a country, but its headquarters is in Germany as well. So the problem here lies in the fact that I was with Dr. Mustafa Kamal Tulba and Dr. Muhammad Abdel Fattah Al-Qassas, my professors at the University of Cairo. I graduated as medicine, but I did sciences. But what matters, Dr. Mustafa Kamal Tulba and Dr. Al-Qassas were explaining to us that mankind is made up 3 components. The first component, for those who cannot live more than 5 minutes, which is the atmosphere. You cannot live without the atmosphere. When you want to dive, it's not more than 5 to 6 minutes. Otherwise, he will die and get suffocated. So we need to really preserve the atmosphere. This atmosphere is made of nitrogen. And the nitrogen in our science is the main component of life. Any life present on Earth, from food, plants, and even man, is made of nitrogen. After nitrogen, 21% remains, because nitrogen is 97% of the atmosphere. So 21%, 20 and a bit is oxygen, which we use to breathe. And the third part is water. Water comes from the sky. And when we say that Ethiopia, we cannot say that they own the water, but the water came from rain to Ethiopia. So the mesosphere, we are talking here about 3 mesospheres. The first mesosphere, which is the first atmosphere. We cannot live without the atmosphere, and if we hurt it, we would be killing ourselves. And then the hydrosphere, without the water, we cannot live, of course, which is less than the salty water. And then the soil producing food. We cannot eat plastic and glass. We need to eat a plant coming from the soil, because when we die, according to the study, what remains of us when we die is 750 grams. So this is the volume of mankind where we become soil, and therefore 3 systems governing us in climate, weather, water, and soil. So what happened? So the climate has changed. Yes, it changed. Why? Because the atmosphere, so we're not talking here about the temperature of the weather. When we say that the increase in temperature 1.5 degrees, which we expect in 2050, if we increase 1.5 degrees, the Earth's surface will create things that we never expected and that happened in the past. Complete change in the Earth's surface. The other part is that there is no alternative, that this Earth's surface, we cannot even, till today, we haven't really find another planet, and therefore these 3 components really affect us on daily basis. The rotation of the moon around the Earth and the rotation of the Earth around the Sun, perhaps every 10,000 kilos in this rotation. So 1 out of 1 million second in this rotation. So it goes. What does this mean? It is one of the reasons behind the greenhouse effect and the human activities, cars, planes, vehicles, trains, all kinds of fuel. This fuel combustion for the fossil fuels, coal and petrol, is the crisis of the weather, and the solution is to turn to petrol and coal. Thank you very much indeed. We have understood that there is a direct link between health and climate change, public health and climate change. And now, due to the reasons of climate change, we've understood the reason behind that. And Doctor will talk to us about the public health policies in facing these challenges. So if it's proven definitely that it has a causal effect, direct causal effect, what can we do? What are the public policies about the Middle East that compared to a number of the regions of the world in the Middle East, true crises that it affected, and the least readiness in the field of public health policies? So kindly go ahead. If you allow me, follow up on the points that you've mentioned. I like that things are simplified, extremely simplified. We, as mankind, we are interacting with everything in this environment, full stop. And the climate changes, or the changes in general, the world is constantly changing for decades and thousands of years. So it is true now that we are facing climate change, rise in temperature, and so on and so forth. And this has negative effects, definitely. The environment is always changing. We had the Ice Age and another age where the rise in temperature. The reason behind that is the world is ever changing. We need to follow up this change and understand what are the difficulties or the things that we need to trespass the productivity of the CO2, and how do we do that? Now, when it comes to the policies and the figures, I think that we're talking here about the World Health Organization, that its principle is to provide welfare for everyone, regardless of the place of this person on Earth. So one of the issues that COVID has sent to us clearly, that what is going on in a certain place, in a part of the planet, will affect us all. And therefore, we need to know what's going on. We need to support each other and work in partnership to face any of the horizons and difficulties, whether in environment or the public sector, public health sector. One of the figures that might be beneficial to give us an idea, especially in the Middle East, the issue of the insurance coverage, because at the end, treatment in a number of countries should be covered, and so we need medical insurance, or they can pay according to the indicator of covering the services to achieve full coverage. The main services are not covered completely compared to most of the countries of the world, whereas the indicator has been lifted from 45 to 66%. Between 2000 and 2017, this indicator is less than 60. And it has a large number of spending where it reaches 40%. Per person, privately paid, because they're not covered via insurance, medical insurance. This will lead to the lack of health care and the ramifications of that. One of the figures that really shocked me, rise in mother's mortality, 166 deaths for every 100,000. Most of these deaths are a result of hemorrhage, for instance, 25%, and infection, 12%, and so on and so forth, which can be treated. These figures as a mother are scary. How can this happen? The figures, yes, are scary in the Middle East, especially in the fields of health coverage and health readiness. To decide once again the policies, health policies, and its relationship with the spreading of pandemics and climate changes. We've seen in COVID that it has spread. So today, the Chinese theory and that of Germany and that of Britain, which means that the countries have their policies differ according to its understanding of the nature. But the lessons learned, and here we are talking about the World Health Organization in the field of world health policies, there should be a kind of coordination and readiness and expectations and prediction for what can happen, because we will have true crises that humanity will pay its price. Dr. Nadim, your evaluation in the Middle East, in the Arabic region, the example of health policies and coordination amongst the entities, its readiness, its effectiveness in dealing with the sicknesses that has proven, according to studies, that it is spread or might be spread in the future. I would like to mention something, that the health change doesn't only need the spread of sicknesses. We have so many different symptoms that come from the bad weather. So we have a problem with respiration, our capability of breathing. This is all local in its specificity. And this is something that we need to caution. There should be development for the capabilities, whether local or otherwise, and therefore we can really trespass it, just as the sandstorms that came last summer and last spring. It started in Iraq and it reached the Arabic Peninsula completely, and it has led to health problems other than the problems that we spoke about earlier. The systems of early warning systems. It should be there, whether for the symptoms of physical components. For instance, weather, when it comes to that weather, inundations, or we can predict sandstorms or fires, there should be really early warning systems so that the local administrations can get ready. And there should be previous or preemptive readiness so that it can really respond. When this occurs, there should be a capability to support externally the local regions. Sometimes the local regions during COVID, they have the capability to support a number of symptoms, but there are more than the current capability. There should be overflow areas that they can resort to so that they can get the help. This we don't have in the region. So we have seen previously fires in the Middle East, whether from Morocco, Lebanon, and Turkey. So no one supported anyone. Barely a few helicopters flew to help out COVID. The borders are not only in the Arabic countries. So it has become really this perspective on the nation without anything else. And therefore, these are the hindrances or the borders that we're talking here about, and to really have no help between one country and another. This is very wrong. doctor has said that the sicknesses will not know any borders. It moves from one country to another without any hindrance. And therefore, and this we do not have at all completely. There are initiatives sometimes, but we do not have regional systems. We need to take heed of that. The Arabic world is really divided from the East and the West and the Arabic Peninsula. Every country has its own specificities, and unfortunately, there are no regional councils that can really deal with these problems or help the regions. Thank you, Doctor. So we are talking about these issues. We have lack in the necessary infrastructure to deal with these sicknesses and its ramifications, climate changes, and to really predict it. The early warning systems are important in these cases, but prioritizing the national interests is not necessary to be beneficial, but it might be hurtful as well because it is trans-border, and this needs to have a kind of institutionalization. These institutions can deal with these trans-border sicknesses. So what needs to be done, definitely, and what are the security challenges that this reality can do? The word is communication. Opening lines of communication, or the points that you've mentioned are true and correct. And the biggest barrier is the issue of communication. Why? Because early warning systems and preemptive weather in urgent cases or during pandemic depends on one thing only: partnership, communication, opening lines of communication. So building a comprehensive system, this is our own objective, but opening lines of communication between institutions, preemptive warning depends on communication. Dengue fever, they've discovered it in a hospital, the other hospital did not know about it. So at the end, it will spread definitely between hospitals. And when it comes to the effect of this, of course, because health is a main basis in the lives of every society. Therefore, if the health sector cannot really accommodate this and give the true health care, there will be destabilization, whether in the society or political or social and so on and so forth, because we are living with it on a daily basis. So health is of vital importance. It has different elements, and therefore I am talking to people. They used to say that the health sector is complicated and so many different factors, and one of the most important points of governance is direct communication, whether between institutions or governments, and a partnership. Because what is happening in one country, perhaps it will affect another country. And at the end, our destiny is one. COVID has shown us what is true, because everyone's destiny is one at the end of the day. If the environment is deteriorated and the sources of water, clean water, has gone, so our destiny is one. If a pandemic spreads, our destiny is one. So at the end, we need to work together. And this idea that we, and not you, this, I think we've matured and reached a new point, and the UAE, of course, in the forefront of this, and history has shown this. We need to work together and help each other in these emerging issues to achieve the desired objectives. Thank you, Doctor. Open communication is primordial. Partnerships, communication, and governance. This is what we need to stress on the institutionalization and the manner in which we can manage this, Doctor, this analysis in reality for the climate change, public health, and the policies to face this, how to deal with it, and the risks emanating from these policies at the level of the new strategy. Of course, the first problem as a global issue, the issue of the Earth's surface. No country can work alone, and no country can create a sample of an independent program, and therefore the first thing is that all countries of the world need to cooperate and participate in the three fields, and therefore we're talking here about the food security. Of course, because you cannot work on a piece of land in Africa, but you can say that Africa is one unit, and therefore we have two continents, the Africa and South Africa. Both of them did not send delegations. Africa 4% and South America, without Brazil and Argentina, 1 out of 10% of the delegations. So when a whole continent is 4% and the European Union alone 44%, and the remaining is distributed between China and America and India. So these are the sources of emissions. So what can we do? The first thing is that we need to have green funding. This is what is going on in Sharm el-Sheikh, that $1 trillion, and then it reached that less than 25% for Egypt. So funding for the countries that got affected is the first priority, first recommendation. Second, the suitable technology. So you cannot really sell me the water plant or biogas or solar panels and tell me that I will sell you this unit worth $500,000. I will tell you no, if you can really participate with me. And this is what's wrong in the grants in the field of environment. Will go to central banks and World Bank, and after to the central banks. At the end, this 10% will become 15% interest rates, and this is the second challenge. The third challenge, that people think that it's easy, that this new world and this new era needs to have a new technology. Smart technology needs people educated completely. So the countries have this responsibility with the world and with UNESCO to graduate the cadre that can deal with what is called smart agriculture, that has no alternative amidst the difficult environment challenges. I have a number of names to enrich the discussion. The first part is Cornelius. Cornelius Adebar, go ahead, please.
Thank you very much, Dr. Zaid. Thank you to all panelists for enlightening us on this crucial issue. I have one question to Dr. Hawaa and another one to Dr. Nadim. Dr. Hawaa, I was intrigued about the way how you linked public health and climate change, because it reminded me that at the beginning of much of the current environmental legislation in the European Union are standards for public health, like air quality, water quality. So it wasn't, foresighting policies, but it was the courts which mandated certain policies. But I have a question, and that is, for you, is public health just a way to explain, like you mentioned, communication? Is it a way to initiate legislation, or is it an actual boundary? Climate change is only relevant as much as public health is concerned. I'm thinking of biodiversity. This is something that is out there and will reach us one way or another, but it may not yet have an immediate effect. And if I may, just to your colleague, Dr. Nadim, about water scarcity. I analyzed the issue of water scarcity in the context of Iran, which is a water-stressed country and has lots of difficult relations with its neighbors. As we heard this morning, it's smack in the middle. So I'm wondering, next to it is this region around the Persian Gulf, the Gulf countries, the GCC, which may have much more in common to, for example, begin an own initiative, how to work on these issues. This is a water-stressed region in itself. We're talking about the COP27 next spring. There is the UN Water 2023 conference coming up. Is this anything where you could see an Arab-led, a Gulf-led initiative on how to deal with water? Thank you very much.
Thank you very much. Let's take this question and react it immediately. Dr. Hawaa or Dr. Nadim, please.
All right, thank you for your question. We're going to have to take a step back about definitions and then my view of it, which is a bit different. I think humans love to categorize things. They love little buckets. There's a bucket, there's a bucket. That's not how I see health or public health. To me, it's merging together.
Can we revert to Arabic, by the way?
حاضر.
Okay.
اللي سألني بالإنجليزي. فمن حيث التعريف.
In terms of definition, what I was saying is the fact that humans by default like to categorize things, to classify, but the healthcare sector should be a space where everything overlaps. There is the health of the humans, the environment, the animals. I think this is all together in its work, and everything is impacting the other. So the healthcare sector has a role of communication, raising awareness, and also conveying information even between entities and institutions. And we are talking about a network in which there is an interaction between different constituents. Even the technology is a platform where we impact and we get affected by other things. So we are talking about the healthcare sector in general. So definition-wise, I disagree. I think that it is one block, and this cascades to every other sector. Nadim, Dr. Nadim, I will answer in Arabic. Let me start from the last point. I would like to say that the Arab countries and the Arab world is divided into two parts. The Gulf countries, the sources of water in these countries is desalination, and this is by the use of energy. And the desalination has a lot of climate repercussions because they consume a lot of energy. And what I mean here is the drain. After the desalination, there is the drain, and we know the impacts of this drain on the climate. So we talk about a plan of collaboration, not only between the Gulf countries, but between the other Arab countries in general. If we would love to talk about Europe, where there are legislations about how to use water, how to counter the air pollution, etc. In the Gulf countries, and in some other countries, there is a high use of water, high consumption of water, and this practice is not sustainable. And I think that in order to overcome this, we should reconsider and review the subsidies given by the government of the Gulf to the consumers of water. For instance, this is on the one hand. On the other hand, there should be more regulation to the practices of digging wells, and there should be initiatives in order to make the water consumption more sustainable. And this applies to the Gulf countries as well as to the North African countries, depending on the degree of scarcity of water. Let me specify the case of Iran. It is not only Iran which is suffering from this, but its neighbor, Iraq, is suffering more, and Turkey as well. And the way of dealing with Iraq in terms of water has been dominant. And it's like a coercion. Iran is taking water from Iraq in a forceful way. There is no respect and there is no peer-to-peer process. So Turkey and Iran, they are dealing with Iraq from a superiority position, regardless of what is the position of Iraq. And of course, there are several regional players who are disagreeing with the practices of Iran and Turkey in the region, especially with Iraq. Regarding COP27, I think that it gives us a glance of hope and silver lining about the financing. Now, the added loss and damages in the agenda, and that is unprecedented. They only talked about it, but this time they set it on the agenda. So that is good to talk about the finances and compensating the developing countries which were affected and harmed more. Yesterday, our colleague Samir was talking about the Copenhagen summit and how reluctant countries were. And we know that when there was a financial crisis, there were trillions of dollars that have been allocated by the Western countries. So when it was about the climate change, there was only $100 billion and it was not reached. The same thing applies to countering the Russian war on Ukraine. There has been an amount of money that is equivalent to billions of dollars to Ukraine, and money emerged suddenly. So this is just to say an example. Mr. Ali, you have the floor. I promised Dr. Hawaa to ask her. I think that the world currently, especially after the pandemic COVID-19, is different. My question is, what are the risks of the diseases that are leaked from the laboratories and that are infiltrating different communities? Because there was a huge debate about the sources of COVID-19, and even some leaders of countries talked about that, the sources of the epidemics and the pandemics, and staying away from the conspiracy theory. We have to question what are the sources of this and whether the climate change has anything to do with that. Dr. Ibtisam? I have a question and a comment. Yesterday, there was a session about climate change and also health. This session is supposed to showcase experiences of the Middle East and the Arab world. So this leads me to ask a question and to share with you a comment. To what extent this region is accused of being a cause of pollution, since it is a region that is producing oil? This region is also accused of contributing to the carbon emissions, but part of this region is prone to all the effects of the climate change currently. My question to all of you: so far I haven't heard what are the policies that could be applied and implemented in our Arab region, because all the speakers in the panel are Arabs. I would like to ask you, based on your expertise, Dr. Nadim, you mentioned Syria. Syria also because of the political situation, because of the refugee conflict, the camps, and the lack of the hygiene. In Syria, it became an exporter of several diseases, and these diseases now reached Lebanon, reached Jordan, and these diseases can reach other countries. So how can we prevent ourselves from such a phenomenon? And what are we required to do in the healthcare sector and also to counter the climate change? I'm talking about the Arab countries. Thank you very much, Dr. Ibtisam. Dr. Hawaa, you have a question by Mr. Ali. You are free to answer his question. So the question of Mr. Ali was about whether we will take into consideration the risk of the laboratories that could leak some diseases and viruses. Of course, this is not an easy question. And I can say that supposedly in all laboratories there should be very tough measures in order to prevent such a scenario, because in the past there was a leak of some germs and viruses. But now there is a new chapter in the way we deal with this incident. Now there is media, social media, and how the news are spreading very quickly around the world. During COVID-19 eruption, I was in my clinic and I received tons of questions, and every time somebody asks me, says, it is said, it is known, but nothing is based on an evidence. So they take this information from the internet. In such emergencies, there is the circulation of what is being said in the internet, but without any smoking gun or any proof, any smoking gun proof or evidence. Before the eruption of COVID-19, there is the Spanish flu in 1918, and unfortunately it was named the Spanish flu, and it had nothing to do with Spain. But anyway, that's another story. We as physicists, we knew that there is a periodic cycle of the emergence of viruses, and every 100 years there is some kind of new pandemic, epidemic, and we should have raised awareness, but we didn't do that. And to answer Dr. Ibtisam's question, I think that the most important thing that should happen is to work together. We have to help each other, because what happens in an A country would reach another country in all sectors and fields. So this is briefly what I can say, because it is a comprehensive philosophy about life, about what we want for ourselves and for the future generations, how we should approach the health sector. Is it a human right? What is the impact of the healthcare on the environment? And I have to mention that the medical waste is a big polluter to the environment, and nobody is talking about it. Thank you very much, Dr. Hawaa. It is a very complicated topic, and we know that we all strive to raise awareness about how to deal with the climate change, and there is a necessity to issue legislations that are serving the healthcare sector and the environment. Doctor, as you said, we are in need of a new approach in how we handle the lifestyle. There are several impacts on the climate change in our daily life, and we in this generation, we feel that more than ever. And also there are other problems that are generated because of this situation. So we have to focus on the conclusions and what's happening in the Arab region. In the Arab region, what should be done, Dr. Magdy? We have priorities. There is the triangle of energy, number one, and this is owned by the Arab countries, and especially the Gulf countries. Second is water, and the third is food. Without this nexus, the Arab world, and especially the Gulf countries, from the borders of Egypt in until the Gulf borders, it is not an arid land or semi-arid land. It is very arid land and not semi-arid land. Still, the oil in these Arab countries made them having energy. Number two, if I want to trade off oil, I can trade it off in return of what? In return of food. And this is how it is going to happen, through projects. I was engaged in the United Arab Emirates in such projects. Now the rain harvesting returned as an imposition nowadays in order to overcome some challenges, and we had a few experiences, and we implemented the rain harvesting. We had one step further, which is to specify the place of the fall of this rain, and we had a project with the UNESCO in which we approached a very high level in the rain harvesting. And I repeat that this experience of course is important and is still limited, and there were some American experts who were telling us that there are some repercussions of that, but when we studied that and analyzed it, we didn't find a lot of effect. So we can deal with the salination of the soil during the irrigation, but I have to apply smart agriculture. I cannot keep open spaces like Egypt because the temperature is very high and there is the desert. So when we apply a project of the rain harvesting, I can say that as if I have 600 acres that are dedicated for agriculture. So in that project, we specified 12 types of the agricultural types, including when we implant and we use agriculture in salinated area. So there were some horizons that were showcased in the Gulf countries, and that allows them to approach the agricultural sector and the food scarcity efficiently by using rain harvesting, etc. I have a question to Dr. Issam. What are the policies that should be implemented in the Arab countries? If we take the example of COP, we see that there is no solidarity in the Arab world in terms of the positions in the negotiations. We find that the OPEC, the oil-producing countries, their main concern is to preserve the production of oil in order to turn their economies that are based heavily on oil. There is a transformation and the transition, but very slowly. And of course, this is at the expense of some countries like Tunisia, Lebanon, Jordan, because the negotiations are hindered and there is a focus on countries which are not a priority or should not be a priority. So I think that there should be a collaboration that is more efficient. We shouldn't take positions at the expense of some other Arab countries. We should base our negotiations on the principle of win-win principle. And there is a better investment currently. And by the way, we have to invest in schools, starting from the primary schools till the universities. It should be stronger and larger in its scale, because from these schools we could come up with solutions that we will use in the Levant, in the North Africa, in the Gulf. There are capabilities that we can invest and utilize, and the solution should emanate from our local context. We should not import these solutions because we have the human capabilities. We should invest in them, and we should focus on that as a priority. And as Dr. Hawaa said, we should focus as well on communication. And I would like to conclude by saying that the climate change is not something that might happen, but it already started, and not now. It started years ago. Now we see its manifestation in stronger ways. It's why we have to take it more seriously. Thank you very much, Dr. Nadim. I'm sure we haven't scratched even the surface of this topic, the climate change and its relation with the healthcare. Of course, we have to exert more effort, but it is the beginning of a long dialogue that we should engage in order to talk about the climate change and its effects on the healthcare and what are the policies that we should issue in order to counter this. Thank you very much for your input, and I thank you very much for your listening and questions. Peace be upon you.